what should you do if you have a new medical condition or a new medication that you think might be disqualifying?
What does a student pilot need to know going into this if they've actually seen a therapist or psychiatrist, got counseling?
If you could give 3 pieces of advice to someone who's going to apply for that first medical, I know we briefly touched on it. What would you tell them to do? And if they're planning on doing in the next year, what documentation do you think they should start planning on saving and looking up?
Welcome to the Aviation Mentors Podcast, the podcast that takes your dreams of flight and turns it into reality.
Sponsored by Strass Financial, financing your flight training.
For pilots, by pilots. I'm Brandon Martini, a commercial pilot and flight instructor.
And I'm Carson Vasquez, I'm a private pilot.
Whether you're a seasoned pilot or beginner with dreams of flight,
Aviation Mentors is your source for expert insights, industry trends, and inspiring stories.
So fasten your seatbelts and prepare for this incredible journey through the skies.
And stay connected with us on social media for exclusive content.
And visit our website at www.aviationmentors.com and let us be your co-pilot on this adventure.
Welcome back, everybody, to another awesome and, of course, amazing episode of the Aviation Mentors Podcast. Thank you so much for joining us today. We really appreciate it. Today, Carson, we have a very, very, very special guest, and I'm very excited to have him on today. We have Dr. Daniel Monlux. He's an FAA Senior HIMS AME who is also board certified in family medicine and aerospace medicine. He began his career in the U.S. Navy and has logged over 3,500 flight hours, including carrier-based combat in the FA-18, which I'm very impressed by. I didn't know that until the show notes now. He also holds ATP certificates and CFI, single engine, multi-engine, and IFR. As a medical director of Wingman Med, Dr. Monlux specializes in helping pilots navigate the FAA medical certification process while minimizing unnecessary disruption. So thank you, Dr. Monlux, for coming on the podcast today. Really appreciate it.
Yeah, thanks, Brandon. Happy to be here. I'm really excited.
Well, we always have one question first, and it's my favorite one because I get to see all the joy. And it's how did you get in aviation, especially with your background? It sounds like some pretty cool parts of aviation that I'm personally really jealous of. So how did that start?
As corny as it sounds, I was 10 years old, which dates me a little bit, watching Top Gun, the first one in the movie theater. And I couldn't believe that those types of airplanes actually existed. And I'd seen Star Wars and I'd seen all the sci-fi stuff. And my dad kept telling me that, no, you can't grow up to be Luke Skywalker. And no, you can't be, you can't fly on the Enterprise. But when I found out that naval aviation existed, that was it for me. And that's what I wanted to do.
I don't know what type of ship the Enterprise is, but did you fly on and land on the Enterprise?
So I never got to land on the Enterprise. There was the USS Enterprise, the aircraft carrier.
Yeah,
I did go on a brief. I actually got to go to sea on the Enterprise briefly, but
I was going to say,
never got to go to distant star systems or anything like that.
Yeah, that's where my mind went, and I was like, that'd be pretty cool, But this is absolutely the next best thing, naval aviation. It's incredible stuff.
I felt so lucky to get there. The planes and land on aircraft carriers is every bit as amazing as you think it might be by watching the stuff on TV. And more than that, I think the people they get to serve with and the relationships you form and just being part of the team in naval aviation is like nothing else in the world. It's really, I feel incredibly privileged to be part of that.
Yeah, I mean, you should be. That's so awesome. The closest I ever get to landing on an aircraft carrier is on the flight simulator on Redbird. I always challenge people to do a carrier landing with no power on a 172, and it's harder than you think it is. But
I'm sure he knows plenty how hard it.
Oh, I'm sure. But we've got our opening question for you today. We're going to ask you a lot of questions about medicals, and hopefully this is one of our most informative episodes for pilots who are starting their journey or in the middle of it or having difficulties with their medical. So I'm really excited that you're here. There's a lot of fear in the pilot community about getting denied for a medical certificate. There's a lot of fear about disclosing things in this industry. I would love for you to kind of tell us what the data actually shows, and then maybe we can go from there.
The data varies slightly from year to year, but generally speaking, more than 90% of pilots who show up for a medical exam with an aviation medical examiner are going to leave that exam with the certificate in hand. So obviously, 10% isn't an infinitesimally small number, but the vast majority of people are going to do just fine going through and getting their medical exam. I think for the people that really struggle with it, it's very rarely that a pilot can honestly look themselves in the mirror and say, "Yes, I'm healthy and I'm safe to fly," and not be able to convince the FAA and the AME of that same idea. The problem tends to be more, I think, people have trouble telling the story accurately. Um, and if you go about it the right way, you're transparent about your health conditions, and you actually are making a little bit of effort to make sure that you're visiting a doctor and controlling any chronic medical issues. The chances that you're actually going to be denied a medical certificate in the final analysis is very, very small. Um, and I think that 90% figure, as large as it is actually, the real numbers are actually more encouraging that from a medical certification standpoint, because that 90% I mentioned is just people who go to a medical exam and then leave with their certificate on that day. For that other 10%, about 90% of those will eventually end up with a medical certificate as well. It's really something on the order of 1% that are actually denied and can't meet the standards to hold a medical certificate.
And I heard that the people who are actually denied that can't meet those standards, typically, if they go through that whole process, they will get done. Or you're saying there's still 1% that just never gets it.
Sure. I mean, there's some people who unfortunately aren't going to qualify for a medical certificate, and on an individual basis, I know that's just heart wrenching, and I know I can only imagine for myself. There's a period in my career where I was wondering. I actually got into a ski accident and was having some trouble with. I had to get surgery on the floor of my orbit, and there was a good couple of months where I was really questioning whether or not I was going to be able to get back into the cockpit and continue my aviation career. So I think I identified on a personal level what it feels like to have those types of doubts and be wondering about it. But I think at the end of the day, as fellow pilots, most of those people who don't qualify for a medical certificate, we would really agree that that's a good decision as peers. These are people that have had strokes and still have motor or neurological deficits, or are suffering from things like seizure disorder, or you know, people with really major debilitating medical conditions that I think just a layperson, that they're not people that you'd really want flying with you in the left or right seat in the same on the same flight deck, quite honestly.
Have you ever seen anybody with well-controlled epilepsy ever given a medical?
Epilepsy is one of the most difficult things to overcome, and so I hate to lead with that example because because that's one of those that is, it tends to be a pretty hard stop. Now there are, if there's a reason that someone had a couple isolated seizures and they've gone for years without medication or recurrence of those seizures, it is possible. I've seen people get back into aviation after having historical seizures, but unfortunately, if you're having ongoing seizures, or you require medication to prevent them, then that is one of the few things that is really going to prevent your medical certification in the grand scheme.
Yeah, and I asked that for kind of a personal reason. There's somebody in my family, I'm not going to mention who it is, but they have epilepsy, and not that they want to fly ever, but it was just something that was very close that I never thought they would ever be able to get a medical certificate. And I was probably right. So it looks like I was probably right in that case. So Carson, going.
Yeah. So, I think I'm closest out of all of us to becoming a student pilot, right? I had that about 5 years ago when I filled out my first MedXpress form. And when student pilots are filling out their first medical application, what's the most common reason that people are really running into trouble there? I've heard from some pilots, don't fill out anything and keep it blank. And some were just like, well, if they find out later, you're going to be in trouble. I opted to just tell the truth, and I got my medical. Not the same day. I was one of that 10%, but I came back 6 days later and got my medical that day. So,
well, that's a great story. That only 6 days between that exam and then being able to get your certificate. So I mean that's a success story in my book, in the grand scheme. No, I think my biggest advice to people is you want to get it right the first time, and so really take the process seriously. Be transparent about it, and make sure that you actually list your medical history appropriately. The three major components that the FAA is looking for is your current medications. So that doesn't include things that you may have stopped even a month ago, but they really want to know about current medications. They want to know about medical conditions ever in your life, and that's a very broad question. There's a number of specific questions they ask, but they really are asking ever in your life. And so there's catch-all there where they ask for specific conditions, and then there's question 18X, which is other illnesses, disabilities, or surgery. And that's the catch-all where if they missed it, that's where everything else goes. And then the final aspect is the medical visits that you've had within the last 3 years. And so you want to make sure that you get that right the first time, because if there's anything in your challenging your medical certificate down the road, they're going to point back to that application you have. And if you've not been forthcoming, not only are you going to be digging yourself out of the hole of the trying to get on record the medical conditions you didn't disclose, but you're also going to be facing potential legal consequences because you falsified a federal application. So that's a general service announcement. Your question was, where do people actually run into trouble with it? And I think for most people, a typical student pilot who's starting out their aviation career, and let's say they're late teens or early 20s, those people are usually pretty darn healthy. You haven't had a lot of the age-related chronic conditions like high blood pressure and diabetes that have come home to roost yet. So in that age group, typical student pilot starting out in the world, I think what I see, especially in our current day population, is people who were maybe in high school during the COVID era and struggled with the social isolation, maybe went through some counseling related to that, had trouble integrating when they came back into the classroom, and experienced some kind of counseling or social anxiety during that transition period. I think that's a very very common reason for the FAA to ask for additional information about from pilots who have been in that situation. And I think most people who have grown up in the last 10 or 15 years probably at least know someone who has been prescribed ADHD medication. And that's something that's a very common practice now. It's prescribed sometimes without the diagnostic rigor that really probably should be done to actually truly credibly diagnose that diagnosis. But from the FAA's perspective, even just a trial prescription of ADHD medication in years past would be grounds for additional information requests. So I think in the young patient population, that's probably it. If you start talking about older folks, maybe coming into it for the first time and they're maybe late career, that they finally have the money to start go after their lifelong dream of becoming a pilot. Now you start looking at just what are the medical conditions in the general population. So then things like high blood pressure, sleep apnea, diabetes, and those are all very easy things to overcome. But that's it tends to be different depending on what age group you're talking about.
And when you talk about those are easy to overcome, what can somebody expect when, let's just say they had high blood pressure or diabetes? What would somebody expect to be follow-ups? And is there anything they can do to bring you a packet, so to speak, and say, hey, I've done all my due diligence. I have everything up front, so I could leave with this medical? Is that even a possibility?
Absolutely. So, one of the things we do at Wingman Med is we offer free consults to anybody who is contemplating a medical for the first time or thinks they might have an issue. And a lot of times we can help to talk people through those scenarios. There's also the FAA does a really nice job of publishing the AME guide online. And so if you're wondering if there's going to be a condition that might affect your FAA medical, you can preface your search term with FAA space AME and then whatever the diagnosis is. So high blood pressure, let's say, or diabetes, or insert your condition there. And 9 times out of 10, the first or second result that will come up in the search engine is going to be the FAA's no kidding, primary reference related to what information you're going to need. But as general guidance, really all the FAA is looking for, if you have a medical condition, they want to make sure that you're seeing a doctor and that the condition is well controlled. And that's really it. And I think for people who try to hide things or sweep things under the counter, they're just missing the point that the FAA is not trying to take anybody out of the sky. They want qualified and safe pilots to be flying, because as you maintain proficiency and you're able to fly consistently, it makes you a safer pilot. Not to mention, there's a pilot shortage out there. We all recognize that, and they have no vested interest in keeping people away from airplanes as long as they're safe. But what I tell every pilot is, even if you're 20 and maybe you don't have any medical conditions, I'm a firm believer that every single pilot should have a primary care doctor and should go see that primary care doctor at least once a year so that you can keep on top of those types of things. Because for the examples that you use, generally speaking, if you've seen your own primary care physician within 3 months of your AME appointment, and you simply bring the documentation from that visit saying, "Hey, Dr. Monlux is diagnosed with high blood pressure. He takes 10 milligrams of lisinopril every day to control it. He doesn't have any other complications, and he doesn't have any effects from the medication." And a couple other little details about, physical exam and what my heart sounds like when they put the stethoscope on it. That's all the FAA wants to see. And for the example of high blood pressure, that allows your AME to give you your certificate right there in the exam room.
Oh, wow. Okay.
I had no idea about that.
I heard that's how you have to do it, but I wanted to hear it straight from you.
Yeah, exactly. And as a matter of fact, so high blood pressure is a great example of something called a condition AMEs can issue. So if you, and this is, I think, a testament for the progress the FAA has made for FAA certification. If you rewound the clock 15, 20 years, something like high blood pressure really would result in a protracted delay and a long wait for your medical certification. But the FAA has incorporated more recent data and actual evidence into their certification policies. And for common conditions like high blood pressure, they have a set of published criteria, and they basically have empowered AMEs in the field to say, hey, if you review those records from the pilot's treating doctors, and it meets all these criteria that we're concerned about, go ahead and you can issue that certificate in the field. You don't have to wait for us to review it. So that's an example of something that in years gone by would have required a special issuance and a delay, but now doesn't delay your medical certification at all.
Fun fact is, my blood pressure was getting high, and I was so afraid of having to take medication, I lost all the weight I lost. So because I didn't want to stop flying or lose my medical.
Well, I guess I'm glad you didn't talk to...
I lost almost 100 pounds. Yeah, if I would have talked to you, I might not have lost weight. But I wanted to get it underneath that number because I was really close to it, and I was going to go over at some point. So, and it kind of depended on the day, it might have been over. So there's some positives too to make you lose weight. But on that fact, actually, I'm curious because there's a lot of things happening in the world right now about people taking GLP-1s. Have you seen anybody ask if they can take a Wegovy or a Mounjaro or any of those types of medications for weight loss and being approved or deferred?
Great question. And in fact, the use of GLP-1 inhibitors for weight loss is one of those khaki conditions I was talking about. So similar to the example I used for high blood pressure, if you are taking a GLP-1 inhibitor, and I don't remember the entire list of medications off the top of my head, but it now includes most of the medications that are they're advertised and common out there. But if you're taking that medication, you're not having side effects, and you can prove that it actually is for weight loss. You're not sort of diagnosed with diabetes and then saying that it's for weight loss. So you have to provide proof that you're not diabetic as well. But again, you bring a note from your doctor saying he's taking this medication for weight loss. He's never had diabetes. He's doesn't have any adverse effects. He's doing well. That's fine. That again, another condition, another medication that does not delay your medical certification whatsoever.
That's really interesting. That's really cool. There's something along the same lines of the concern that people have, and as widespread, I think, as the GLP-1. It's about mental health, and I think a lot of people have that mental health concern. And a lot of people just say that pilots don't want to go and get mental health care because they're afraid they're going to lose their medical over it. And I know a lot of student pilots are afraid of that, or people who want to become student pilots. So what does a student pilot need to know going into this if they've actually seen a therapist or psychiatrist, got counseling? What are they looking at for this process?
I think that's a great question, and it's relevant to so many people right now because in our society as a whole, I think mental health conditions still have some stigma attached to them, but it's becoming much, much more common for people to seek help, and that's much more acceptable in our course, socially. The FAA in many ways is they're trying to keep pace, but they've lagged behind in some ways, and they also have a really big burden from a public safety perspective because you don't have to look too far in the distant past to find examples of pilots committing suicide by airplane. And there's the Air India is one that may be the most recent example. The German wings going back somewhat somewhat back into the past. So it's not without precedent that pilots uh, with suicidal ideation or mental health issues have not just taken themselves down, but tragically a number of people on board the same aircraft with them. So it's super important that the FAA does exercise some amount of scrutiny to make sure that when the pilot reports that they've been depressed, that they've been depressed, but they sought treatment. They're now better. They're stable, and not they're depressed. They're on the verge of suicide, and if they get their medical, the first thing they're going to do is an airplane to affect that. And so I think while it's a very serious situation, I think what's super important for people to understand is that it's okay to get help. And if you get to a point where you are feeling better, you will get your medical certificate, no questions asked. Well, I shouldn't say no questions asked, but if you get to
A lot
that
of
point
questions
again, that we
asked.
A lot
talked
of
about,
questions.
and there will be questions. But if you get to that point where you can honestly say, "Hey, yeah, I am safe to fly. I'm in a good place now," and you'll be able to get an assessment from a mental health provider and be able to demonstrate that. And so the FAA, similar to the CACI program, they've expanded the list of conditions to include things like general anxiety disorder, adjustment disorder with depression, social anxiety disorder, even PTSD, and there's a more extensive list as well. But if you have one of those conditions, you can actually have up to two, and as long as it's well controlled and you haven't had any really significant severity episodes like hospitalizations or suicide attempts or very recent medication use, you can qualify for a medical certificate again at the exam. I think something else to that's really important to point out is that counseling for conditions like relationship stressors or grief or just financial issues or maybe even anger management, if you don't have a diagnosed medical condition and you're just trying to get help by going to counseling and sort of seeking some life coaching, if you will, that's not even reportable on those list of visits to the FAA. They're really only concerned if you're seeking counseling for a substance abuse issue or for a more significant mental health issue that's really impacting your ability to function in the world.
That's really good to know. I've been using this subject as kind of a talking point whenever I talk with the general public that doesn't know anything about aviation or flying in general. And I always ask them this: would you want your pilot to be depressed and not say anything so they don't lose their job, or would you rather them say something and get the medication? I know you and I probably have a little bit of a difference in opinion on this. We've talked about it prior to the show. But it's been really funny how everybody I've asked who's just a normal person that just flies in the back of an airplane, they always tell me the same thing. Oh, I'd rather the pilot go get. Actually, they tell me one of two things. They rather me say, fire that guy. They want the best of the best only, and they don't want anybody else in there. That's probably a third of people, by the way. And then the other 2/3 say, oh, I'd want them to get diagnosed because they're just like a normal person, except for now they have to hide it and they don't get medicated. And I feel like that's what a lot of the reform's been around lately, and destigmatizing it and making sure people can get their medicals and it's been interesting whenever I ask people that question. A lot of them are okay with it. I might say it in a pointed way though, so I don't know. It could be a little different, but
And again, I think there's much wider acceptance in society that pilots are people. They can go get treated and they can get better. And pilots can be approved on while taking antidepressant medication. The process a little bit longer, but even that has gotten much shorter. One of the most recent changes, believe it or not, that the FAA made is that you used to have to be on a stable dose of medication uh, for 6 months before you could be considered. They've reduced that now to 2 months, um, which is a really obviously makes getting back into the cockpit for effectively treated mental health issues much more accessible for people. So I think that's a really encouraging change. and they've really across the board they sped up the review process for review of complicated applications. It used to be that if you were that 10% that got deferred and couldn't leave with your medical certificate in your hand, you'd very often be waiting for 3 to 6 months or even longer. That timeline is shortened dramatically, and I'm seeing people often approved within a month, sometimes rarely as many as three. But they made tremendous strides in the efficiency which they will process applications, and also with I think applying, they push some of the decision making down to lower levels within the FAA so that they can actually uh, process these things at lower levels and keep things moving along.
Interesting.
That's cool.
You know what time it is, Carson?
Time is it, Brandon?
It's time to talk about one of our favorite companies.
Which company would that be?
Aviation Mentors is excited to be sponsored by the one and only Stratus Financial, dedicated to supporting the next generation of future aviators.
You know, Stratus Financial really understands the financial challenges that students face in pursuing their aviation dreams. That's why they offer student loans specifically tailored to aspiring pilots.
With competitive rates and flexible repayment plans, Stratus Financial helps take your aviation education to new heights.
So go visit their website today at www.stratus.finance. Just to be clear, that is not .com, it's .finance. And embark on your journey towards a sky full of possibilities.
Carson, it's time to get back to what we do best.
The show.
The show.
You mentioned something about substance abuse. And I know this is something that comes up quite a bit. And it's about DUIs. I think there's a part of the application where you have to disclose DUIs in particular, but I think felonies.
DUIs and felonies, and that's listed on the medical questionnaire, and actually on IACRA when you answer it as well.
Yeah. So part one of that is, do all these felonies? Is there anything that the actual AME has to do with that, or is that just happens to collect that information at the same place? And part two is people who have a DUI in their history. How do they go about getting their medical back if they have lost it or get it for the first time?
So that all depends. So the bottom line is it really depends. The FAA is not concerned about the DUI per se. They're concerned about what a DUI says about your level of alcohol use and the potential for dependence. So I think, just without even thinking about certification, as you think about people in your life and people who've had DUIs and that about. You evaluate somebody different who has had 2 DUIs than 1 DUI, or 4 DUIs compared to 2 DUIs. And if their BAC was just right at the legal limit, maybe a .09, and they were in fact pulled over for a broken taillight versus .24, which is 3 or 4 times the legal limit, and swerving all over the place and involved in an injury accident. And so they take all that stuff into account. And then of course, being the fact that it's the federal government and they need to make it a bureaucracy, they kind of run all that through there's a flow chart and a step-by-step process. So how it all breaks down, if they use blood alcohol of 0.15, which is approaching 2 times the legal limit for DUI. And generally speaking, if it is a single DUI and it's less than that 0.15, they're going to collect a bunch of information about it. They want to see the arrest record. They want to see proof that that in fact was the BAC level. But more than likely, if it's your first time DUI and it was less than that, it wasn't a severe, 0.2, blood alcohol level, you're more than likely going to get your medical certificate without too much delay. That's especially true if it was less than 0.15 and it was more than 5 years in the past. As long as they collect the proper information, your AME can actually issue a certificate in that case. They're not going to be able to do that if it's very recent. The FAA is going to want to review it, but chances are you're going to get a favorable decision there. If you're talking about 2 or more DUIs, or your blood alcohol level was greater than 0.2, which is very, very drunk, and I think most people who don't have some level of tolerance to alcohol probably wouldn't be able to get into the car or even maneuver onto the roadway with the blood alcohol level of 0.2 or more. If you're getting pulled over in circumstances like that, Well, then you're probably going down the road of monitored abstinence, meaning you may get your certificate after a period of evaluation, but the FAA is going to keep very close tabs on you. They were going to make you apply using a specially trained AME. They're probably going to have you request that you do a psychiatric assessment to rule out other more severe psychiatric or substance abuse issues. And you're going to have to do some random drug and alcohol testing to make sure that you're not relapsing in that case. So it's a quite long process. And then in the middle, you kind of have, kind of mid-level DUIs where they may do an evaluation, and it's a case by case basis. But the extremes, I think, are pretty easy to sort out.
Thanks. I always thought that part was really interesting to me because I've heard it's total shutdown, DUI. You lose your license, you lose your medical, you lose everything, or you could never get it in the first place. So thank you. That makes a lot more sense.
They definitely take it very seriously, and
Absolutely, it should.
I think the flying public probably doesn't want drunk pilots. I think that's probably foregone conclusion. But there is some recognition that you can make mistakes, and for first time DUI, you're going to have some questions to answer. It's not going to be absolute no for medical certification, but first time DUI without an extreme level of intoxication, and chances are you'll be able to get back in the cockpit in relatively short order, meaning a couple of months. And as long as you don't do it again, then you get that mulligan, so to speak.
Awesome. Thank you.
I'll take this next
Okay,
one.
go for
So
it.
I have actually a direct question because I don't go to the doctor very often, but I'm finally going to go to the doctor for an issue with my hands that I have lately.
I thought this was your doctor appointment.
Not my doctor appointment. No, not today. And I'm going there, I think, tomorrow or the next day or something. And I know there's like a trigger finger issue, but I know he's going to give me a shot in my hand. I can't think of the name of the medicine right now, but he's going to give me a shot in my hand. How long am I supposed to go before I'm allowed to fly after he gives me that shot in the hand? Or do I have to go get a new medical? Or do I have to go report it immediately? Or do I have to just wait till my next medical? I know the answer to this, but I would like to hear it from you so we could give it to our public. And then the same kind of question besides just that shot in my hand, the pain shot, which I knew what it was called. How about if somebody takes NyQuil the day before they were supposed to go flying? Something like that. So maybe those two examples.
A lot to unpack there. So I'll take one part, which is just generally, what should you do if you have a new medical condition or a new medication that you think might be disqualifying? It's a little bit tricky because really you're not under any immediate obligation to report those things to the FAA. During the validity of your medical certificate, you essentially act as your own flight surgeon, your own medical examiner. And so it's really your responsibility. The governing regulation is 14 CFR 61.53, which is a prohibition against flying during a known medical deficiency for anybody who likes to look those things up. But basically what it says is you need to make a self-assessment as to whether or not you're safe to fly. So that's again where you can kind of look up FAA AME and the condition that you're concerned about. And you can look to see if the FAA has a policy on it as to whether or not it's disqualifying or not. But for really basic things, and I kind of want to put your trigger finger into this category. If you're having kind of minor symptoms related to something, or you have a cold, or you have an ankle sprain, and that thing is obviously self-limited, you're not under any obligation to go back and get a new medical certificate. You can just wait till it heals, wait till you can put some weight on the ankle, so you can move your hand around without any pain, and then go start flying again based on your own judgment.
It was called a cortisone shot.
Yeah. Well, and so I was going to get to that. So I'll come back to that. I was just to finish that thought. On the other end of the spectrum, if you have a heart attack or new onset diabetes or something that's a little bit more nuanced and really needs something more than a self-assessment, where you really should be consulting with a medical specialist, that's when you should probably take a break, say, hey, I need to get my healthcare and my personal safety under control. Again, get to that point where you can honestly say, yeah, I'm safe to fly because my cardiologist says so, or my endocrinologist says so. And then you can go and present that information to an AME, ideally with all the supporting documentation from your specialist to support it, and let the FAA make a decision on it. So there's a little bit of a kind of, it depends. But for self-limited stuff that doesn't interfere with your ability to fly, most musculoskeletal things or transient illnesses fall into that category. You could use your own judgment. On the medication side, and so I figured it was probably a corticosteroid injection you were going to get.
There it is.
There's not really a specific limitation for that. So you want to make sure you don't have any reaction to the medication, and and that whatever you're treating is not debilitatingly painful to the point that it's going to interfere with your ability to operate the airplane. There's some limits on systemic steroids if you're taking it daily over the course of time, that you would need to potentially seek a special issuance for that. But for a one-time anti-inflammatory shot, in your case, that's not something that would really independently keep you out of the sky. You bring up a great question with NyQuil. One of the most common disqualifying medications that people take is NyQuil and related medications, particularly anything labeled with a nighttime or PM type dose, because that very often will contain either Benadryl, which is a brand name for diphenhydramine, or another similar first generation antihistamine, which are very sedating medications and stay in your system for quite some time. And so if you're taking any type of sedating medication, you need to know, you can look on the package labeling or online, but you need to know what that half-life is, and either multiply that by 5 from your last dose before you get back in the airplane. And that's a little bit complex for some people. You can also look it up on the FAA's website, and they'll have guidance for a lot of these common medications. We also, on wingmanmed.com/meds, you can look up our general guidance on what medications and wait times after dosing to get some idea with it. But be very, very careful for using over-the-counter medications, because there's a lot of sedating stuff out there that people don't think about and could really affect you from a safety perspective that you want to avoid, or at least wait till it washes out of your system before you go fly.
That's really cool. Yeah, I know. That's why I remember my instructor telling me, those first generation ones were a no-go. But what about the newer generation of antihistamines, things like Allegra, as opposed to things like Benadryl, which will just knock you out?
The typical second generation antihistamines, there's really 4 that I see used pretty commonly. So there's Allegra or fexofenadine. There is Claritin or loratadine. There is Zyrtec or cetirizine. And then there's Xyzal or levocetirizine. And so don't expect people to remember all that. But of those, the Claritin and Allegra are A-okay. You can use those every single day. FAA doesn't care about it whatsoever. They're considered non-sedating, and you're fine. Both Zyrtec and Xyzal are considered sedating antihistamines by the FAA. And if you take those, the same basic rules apply as I discussed for Benadryl or the first generation antihistamines. You got to pay attention to which one you're taking and make sure what the FAA policy is on it, because they can be very important.
And will those be considered reportable medications? Both sides of that, the non-drowsy one as well as the drowsy one?
Yes. Yeah. So when you're filling out MedXPress, any medication that you take on a regular basis should go on there. And that includes whether it's prescribed by a doctor or whether you buy it over the counter and take it occasionally or consistently, I should say, for symptoms. Now you get a little bit of editorial license if you have a bottle of Motrin in the medicine cabinet, and just in case you twist your ankle and you want to have something on hand, and you take it once a month, that's not really a current medication. But if you have allergies and you're taking an antihistamine a few times a week, you should probably list that. And again, this is about transparency and credibility. It's not so much that the FAA cares. It's just that, the more you work with them, the easier it is to maintain your medical cert.
Awesome.
If you could give 3 pieces of advice to someone who's going to apply for that first medical, I know we briefly touched on it. What would you tell them to do? And if they're planning on doing in the next year, what documentation do you think they should start planning on saving and looking up? Because I'll tell you this, I could not tell you the last time I went to the doctor. It would take me hours upon hours to figure out and look at my calendar and hope it was correct. And I don't even have a primary care doctor for myself. So I wouldn't even be able to look to know like what I did. I don't even know the doctor's names anymore. Besides probably what's on MedXPress. I can probably look on there and pick some of it up from past years. But what's some advice you would give people when they're ready to do that? And even if they have a medical, it's been 4 years and they have to do it before 60 months is up. Now they've got to go reinstate their third class. What would you say?
I think the most important thing is, again, I've said this a few times, but make that honest self-assessment. And if you have some healthcare issues that you've kind of been putting off, make sure you actually get those addressed. I think that's the biggest thing is you should really take aviation seriously, take aviation safety seriously, and make sure that you're doing your part to be as healthy as you can before you jump back into the airplane and start flying. So with that general theme in mind, go get yourself a primary care doctor, schedule that annual appointment, get some blood work done, and see if he has any treatment advice, if you have any acute issues that you need to get addressed. Kind of go take yourself in, do some preventive maintenance, and actually make sure that you don't have anything. So when you fill out MedXpress saying that you don't, that you're doing okay. And if you do have some issues, then start treating it. At least get on the way to getting those things under control. And that way you're putting your best foot forward, and you're disclosing your medical history in good faith when you do fill out MedXpress. So I think that's the biggest thing is keep an eye on your own medical care. Make sure you're doing your part to stay healthy and to control your chronic medical issues. And then that way you're filling out MedXpress in a forthright way. The second thing is, once you do that, don't go into your AME just expecting them to help you through the process. And I think this is a really important point I'd like to circle back to, but do some due diligence once you figure out what your medical conditions actually are and figure out what the FAA policies are. And so that can be setting up a free consult with us. We offer something called a MedXpress simulator where you can go and fill out a mock application and have either myself or my partner review it and kind of give you an estimate of what's going to be in store for you, how complicated your application is going to be. And that way you can make an informed decision about whether you should schedule that AME exam or if you need to take a little bit more time gathering documentation before you get into it. So I would say, make sure I'm going to limit it to two pieces of advice. I would say, well, I'll give you three. So self-assessment, make sure that you actually get you have a current credible appointment with your primary care doctor, and then make sure you do some due diligence so you understand what the FAA medical certification consequences are.
That's fantastic. And I know we're kind of coming up at the end of the clock, so I'd love to ask you one last question. And where can people find you, either online or social media or phone, or you name it? Where can people find you if they ever want to reach you? And what's the best resource?
So the best way for us, we have our website, wingmanmed.com. If you think you have an issue and need to get in touch with us, want to know more about how your medical issues might affect your eligibility for FAA medical certification, there's a big free consult button right in the middle. You click on it, fill out some basic information, and we'll get you scheduled. So that's far and away the easiest way to get in touch with us.
Well, that's fantastic.
Yeah. Well, thank you so much for your time today. I've always heard be really honest on your application, and I was on mine. I've told a lot of people to be, but they don't seem to believe me. They're always so concerned. So I feel like I'm a little bit more prepared to help others, and I really appreciate it. Thank you.
Thanks for having me, guys.
Yeah, from meeting you on that cruise ship with King Schools until today was a little bit of a journey, about 2-3 months with all the holidays and whatnot. But I'm grateful we were able to find a date that worked out for all of us, and I'm sure our listeners and watchers really enjoyed it today. I know I sure did. I learned a little bit of something, and I'm sure our listeners learned a lot. So thank you again, Doctor, for being on today. As always, now you know where to reach Dr. Monlux. If you'd like to reach either me or Carson, you can reach us on our emails, brandon@aviationmentors.com, carson@aviationmentors.com, or for producer Mark, producer@aviationmentors.com. Also, don't forget LinkedIn is probably the best and easiest way to get hold of us. We respond pretty quickly on there. Plus, you can connect with us and see where we're doing and how business is going. Also, don't forget to hit like, follow, subscribe, share, all the fun things you're supposed to do with social media and YouTube if you're watching us today. on whatever streaming platform or social media. So thank you again. It's a huge part of helping us grow the podcast and grow the aviation community at large. So stay safe. Thanks so much.
And as a wrap up for the day, remember, here to guide you in your aviation journey. So fly safe and enjoy the ride.
See you.